Hi everybody, I'm Dr. Alex Pastuszak and I'm a urologist at the University of Utah who specializes in men's health. I wanted to talk to you for a minute about erectile dysfunction, or ED. At this point, this is something that most men have probably heard about and, statistically speaking, potentially experienced. And I wanted to make sure that we cover the basics of ED from the standpoint of someone who sees and treats ED every day, like me. So what is ED and who is affected? So ED, by definition, is any difficulty having or keeping an erection that's good enough for sex, plain and simple. Men can be affected at any age, but more men are affected the older they get. For example, about 50% of men between the ages of 40 and 70 years old have some measure of erectile dysfunction. But regardless of how old you are, if you're having trouble having or keeping an erection, I would suggest that you get checked out. So what are the causes of ED? There are a number of these, and these range from psychological to hormonal to surgical to blood flow issues. The most common, which represent about 90 to 95% of cases, are vascular or problems with blood flow into or out of the penis. Since testosterone is really critical for normal erections, it's also really important that you make sure that you check your hormone levels if you have any problems with your erections. If you have ED, it's also important to get checked out because ED can be an early sign of heart disease, since the penile arteries are much smaller than the arteries in the heart. So what can men do about ED? Fortunately, there are a lot of treatments for ED, and we tell almost 100% of the men who come to see us that we can get them going again. Treatment options include oral medications like Viagra, Cialis, Levitra, or Stendra, which most men have heard about, injections that men can give themselves into the penis. Don't worry, they really don't hurt, but they work really, really well. Vacuum erectile devices, and penile implants, which we put in surgically. Hormone therapy is also often an important adjunct treatment for ED and can help some men have stronger erections within about 3 to 6 months of starting. So I hope this helps put this pretty common condition in context. To you guys out there who are affected, don't be bashful about seeking help. There are healthcare practitioners out there who can help get you back up and going.